viewers, this is Dr.Toqeer Abbas once again here. It's morning here in Lahore, and I am with my colleague taking morning tea. So, the pending topic was talking about the science behind the stay healthy life, how to stay healthy. So, today we are going to talk about the healthy. اب جو ہے نا ہم اس پہ بات کریں گے کہ آج کل جو ہے نا اسپیشلی نوجوان نسل جو ہے نا بہت جلدی اراؤنڈ 40 ایئرز اولڈ اور وہ جو ہے نا 50-60 سال کے دکھنا شروع ہو گئے ہیں. تو اس موضوع پہ ہمارے بات کرنے والے ہیں ڈیٹیل سے. ہمارے ساتھ ایک ینگ اسپورٹس مین بھی ہے جو اس چیز پہ زیادہ روشنی ڈالیں گے کہ ایک صحت مند زندگی کیسے گزاری جائے, ایسی کون سی غذائیں کھائی جائے, ایسی کون سی ایکسرسائز کی جائے, ایسا کون سا ٹائم ٹیبل شیڈیول بنایا جائے کہ یہ جو آج کل 20 سال والے 60 کے دکھ رہے ہیں, 60 سال والے جو بہت ہی کم تھے وہ نظر ہی نہیں آتے. ہمارے ساتھ ہیں یہ ایک اسپورٹس مین, ان سے پوچھتے ہیں کہ یہ کیا کہنا چاہتے ہیں.
السلام علیکم, میرا نام ہے حیدر, میں ہوں ایک اسپورٹس مین. میں آج آپ کو بتاؤں گا صحت مند زندگی کا راز. صحت مند زندگی گزارنے کے لیے سب سے پہلے آپ کو ٹائم سے سونا اور ٹائم سے اٹھنا, یہ بہت ضروری ہے. اس کے بعد میں نے دیکھا ہے ہمارے معاشرے میں بہت سارے ایسے لوگ ہیں جو کہ 40 سال کی عمر میں ایسا لگتا ہے کہ 60 سال کے ہیں, اور 20 سال کے لگنے کے جو 20 سال کے لوگ ہیں وہ لگتے ہیں 40 سال کے. اور ہمارے معاشرے میں اس طرح کے لوگ بہت کم ہیں جو کہ 60 سال کے ہونے کے باوجود 30-35 سال کے لگے. تو میں آپ کو بتاتا ہوں کہ میری عمر اس ٹائم 35 سال ہے, لیکن میری ایکسرسائز کی وجہ سے اور جلدی سونے کی روٹین کی وجہ سے میری صحت اور میری صحت کا راز یہ ہے. اور دوسری بات یہ کہ محنت بہت زیادہ ہے, ٹرانسپورٹیشن نہیں ہے یہاں پہ. لوگ اس طرح کے یہاں سے بیٹھتے ہیں اور اگلے چوک میں جا کے اتر جاتے ہیں. لوگ صحیح طرح ایکسرسائز نہیں کر سکتے, اور جو دیہاتوں میں لوگ میلوں دور ایکسرسائز پیدل چلتے ہیں, جس کی وجہ سے وہ صحت مند. 3 چیزیں ہیں زندگی میں, ایک جو ڈاکٹر صاحب بتائیں گے اور 2 جو میں. ایک ایکٹیویٹی, جیسے کہ میں فٹ بال کھیلتا ہوں, انسان کو اپنی زندگی میں کوئی نہ کوئی ایسی ایکٹیویٹی اپنا لینا چاہیے جس کی وجہ سے وہ فٹ رہے. اور جو دوسری ہے وہ نیند, جو کہ جلدی سوئیں اور جلدی اٹھیں. یہ بھی ایک صحت مند زندگی گزارنے کے لیے بہت ضروری ہے.
اچھا حیدر صاحب, جو دیہاتوں کے ہمارے جو لوگ ہیں وہ ان کو اگر ہم کمپیئر کریں آج کے لوگوں سے, آج کی جو جنریشن ہے جو اسپیشلی شہروں میں ہے, تو اس کو آپ کیسے دیکھتے ہیں؟ میں بھی بتاتا ہوں, لیکن آپ چونکہ دیہات میں بھی رہ کے ہیں, ابھی شہر میں بھی رہتے ہیں, آپ کو زیادہ ایکسپیرینس ہے, تو ذرا بتائیں دیہاتوں کے لوگ شہر والے لوگوں سے زیادہ کیسے اتنے ایکٹیو ہیں.
Well, here I'm going to tell you WHO, World Health Organization instruction. So, according to WHO, how to live a healthy life. So, around 20 healthy tips in 2023 I'm going to share with you. That's WHO instruction. So number 1 is eat a healthy diet. Now what to eat? Eat a combination of different foods including fruit, vegetables, nuts and whole grains. Adults should eat at least 5 portions, that is 400 grams of fruit and vegetables per day. You can improve your intake of fruits and vegetables by always including veggies in your meal, eating fresh fruit and vegetable as snacks. eating a variety of fruits and vegetables and eating them in season. By eating healthy, you will reduce your risk of malnutrition and non-communicable diseases as NCDs such as diabetes, heart disease, stroke and cancer. And number 2, consume less salt and sugar. So consume twice the recommended amount of sodium, that is Filipino, putting them at risk of high blood pressure, which in turn increase the risk of heart disease and stroke. Most people get their sodium through salt. Reduce your salt intake to 5 grams per day, equivalent to about 1 teaspoon. It's easier to do this by limiting the amount of salt, soy sauce, fish sauce, and other high sodium. When preparing meal, try to add less salt. On the other hand, consuming excessive amount of sugar increase the risk of tooth decay and unhealthy weight gain in both adult and children. The intake of free sugar should be a teaspoon for an adult. WHO recommends consuming less than 5% of total energy intake for additional health benefits. You can reduce your sugar intake by limiting the consumption of sugary snacks, candies, and sugary sweetened beverage. Number 3, reduce intake of harmful fats. Fats consumed should be less than 30% of your total energy intake. This will prevent unhealthy weight gain. There are different types of fats, but unsaturated fats are preferable over saturated fats and trans fats. WHO recommends reducing saturated fats to less than 10% of total energy intake, reducing trans fats to less than 1% of total energy intake. The preferable unsaturated fats are found in fish, avocado, nuts, sunflower, soybean, canola, olive oil. Saturated fats are found in fatty meat, butter, palm and coconut oil cream, cheese, ghee and lard, and trans fats are found in baked and fried food and pre-packed snacks and foods such as frozen pizza, cookies, biscuit and cookies oil spreads. Number 4, avoid harmful use of alcohol. There is no safe level for drinking alcohol. Consuming alcohol can lead to healthy problems such as mental and behavioral disorder, including alcohol dependence, major NCDs such as liver cirrhosis, some cancer and heart disease, as well as injuries resulting from violence and road clashes and collision. Number 5, don't smoke. Yes. Smoking tobacco causes such as lung disease, heart disease, and stroke. Tobacco kills not only the direct smokes but even non-smoker through second-hand exposure. Currently, there are around 15.8 million Filipino adults who smoke tobacco, but 7 in 10 smokes are interested or plan to quit. If you are currently a smoker, it's not, yes, I'm telling here, it's not too late to quit. Once you do, you will experience immediate and long-term healthy benefits. If you are not a smoker, that's a great. Do not start smoking and fight for your right to breathe tobacco smoke-free air. Number 6. Number 6 is be active. In early age, especially young people around 15-20, they must build their body. that this is like a investment. Be active, do exercise, invest on your body today. Invest on your body. Here I'm telling it today, invest on your body, so later in 50, 60 you will be active and you will be serving that you have gained in 20 years. Physical activity is defined as any body movement produced by skeletal muscle that require energy expenditure. This include exercise, activity undertaken while working, playing, carrying out household chores, traveling, football, cricket, engaging in any kind of activity. The amount of physical activity you need to depend on your age group, but adult 18-64 years should do at least 150-minute moderate intensity physical activity throughout the week. Means 30, 20, 25 minutes per day. Increase moderate intensity physical activity to 300 minutes per week for additional healthy benefits. And number 7, check your blood pressure regular. Yes, check your blood pressure regularly. Hypertension or high blood pressure is called a silent killer. This is because many people who have hypertension may not be aware of the problem, as it may not have any symptom. If left uncontrolled, hypertension can lead to heart, brain, kidney, and other disease. Have your blood pressure checked regularly by a health worker so you know your number. If your blood pressure is high, get the advice of your health worker. This is vital in prevention and control of hypertension. And now number 8, get tested. Getting yourself tested is an important step in knowing your health status, especially when it comes to HIV, hepatitis B, sexually transmitted infections, and tuberculosis. Left untreated, these diseases can lead to serious complications and even death. Knowing your status means you will know how to either continue preventing these diseases, or if you find out that you are positive, get the care and treatment that you need. Go to a public or private health facility wherever you are comfortable to have you tested. Number 9, get vaccinated. Vaccination is one of the most effective ways to prevent diseases. Vaccine work with your body natural defense to build protection against diseases like cervical cancer, cholera, diphtheria, hepatitis B, influenza, measles, mumps, pneumonia, polio, rabies, rubella, tetanus, typhoid, and yellow fever. In the Philippines, free vaccines are provided to children 1 year old and below as part of the Department of Health routine immunization program. If you are an adolescent or adult, you may ask your physician if to check your immunization status or if you want to have yourself vaccinated. Number 10 is cover your mouth when coughing or sneezing. So that means disease such as influenza, tuberculosis, pneumonia are transmitted through the air. These diseases are very contagious. When an infected person coughs or sneezes, infections agent may be passed on to others through airborne droplets. When you feel a cough or sneeze coming on, make sure you have covered your mouth with a face mask or use a tissue, then dispose it carefully. If you do not have a tissue close by, when you cough or sneeze, cover your mouth as much as possible with the crook of your elbow. Number 12, prevent mosquito bite. Mosquitoes are one of the deadliest animals in the world. Diseases like dengue, malaria, lymphatic filariasis are transmitted by mosquitoes and continue to affect many people over the world. You can take simple measures to protect yourself and your loved ones against mosquito-borne disease. If you are traveling to an area with known mosquito-borne disease, consult a physician for a vaccine to prevent disease such as Japanese encephalitis and yellow fever, or if you need to take anti-malarial medicines. Wear light colored long sleeved shirts and pants and use insect repellent. At home, use window and door screen, use bed net, and clean your surrounding weekly to destroy mosquito breeding sites. Number 13, follow traffic laws. Road crashes claim over 1 million lives around the world and million more are injured. Road traffic injuries are preventable through a variety of measures implemented by the government, such as strong legislations and enforcement, safe infrastructure, and vehicle standard improved post-crash care. You yourself can also prevent road crashes by ensuring that you follow traffic laws such as using the seat belt for adults and children, restraint for your kids, wearing a helmet when riding a motorbike, motorcycle, bicycle, not drinking and driving, and using mobile phone while driving. Number 14, drink only safe water. Around 40 to 50% is nowadays drinking unhealthy, not purified water. Drinking unsafe water can lead to waterborne disease such as cholera, diarrhea, hepatitis A, typhoid, and polio. Globally, at least 2 billion people use a drinking water source contaminated with feces. Check with your water and water refilling station to ensure that the water you are drinking is safe. In a setting where you are unsure of your water a source, boil your water for at least 1 minute. This will destroy harmful organisms in the water. Let it cool naturally before drinking. And here, number 15, breastfeed babies from 0 to 2 years and beyond. Yes, breastfeeding is the best way to provide the ideal food for newborn and infant. WHO recommends that mother initiating breastfeeding with 1 hour of birth. Breastfeeding for the first 6 months is crucial for the baby to grow up healthy. It is recommended that breastfeeding is continued for up to 2 years and beyond. Aside from the being beneficial to babies, breastfeeding is also good for the mother as it reduces the risk of breast and ovarian cancer, type 2 diabetes, and postpartum depression. Number 16. Number 16, talk to your friend or someone you trust if you're feeling down. Depression is a common illness worldwide with over 260 million people affected. Here, depression can manifest in different ways, but it might make you feel hopeless or worthless or you might think about negative and disturbing thought a lot or have an overwhelming sense of pain. If you are going through this, remember that you are not alone. Talk to someone you trust, such as a family member, friend, colleague, or mental health professional about how you feel. If you feel that you are in danger of harming yourself, contact. Take antibiotics only as prescribed. Antibiotic resistance is one of the biggest public health threat in our generation. Here, especially in village and areas where education is less, uh, I experienced mostly patient, especially mother of the children, they come to our clinic, and here I can tell you they expect doctor start antibiotic in the very first visit, even for common cold or viral pharyngitis. So antibiotic resistance is one of the biggest public threat. When antibiotics lose their power, bacterial infection become harder to treat, leading to higher medical costs, prolonged hospital stays, and increased mortality. Antibiotics are lose their power because of misuse and overuse in human and animal. Make sure you only take antibiotics if prescribed by a qualified health professional. And once prescribed, complete the treatment days as instructed. Never share antibiotics with other children or other people, and never stop taking without uh, talk to your doctor or without complete the course. And number 17, clean your hands properly. Drink purified water, clean your hands properly before eating is one of 20 tips is one of the major tip. Hand hygiene is critical not only for health workers but for everyone. Clean hands can prevent the spread of infectious illness. You should hand wash using soap and water when your hands are visibly solid, a hard rub using an alcohol based product. Now, here one more is stay hydrated. The hydration is an important and often overlooked marker of health. Staying hydrated helps ensure that your body is functioning optimally and that your blood volume is sufficient. Well, drinking water is the best way to stay hydrated as it's free of calories, sugar. Although there is no set amount that everyone needs per day, around 8 glass per day is enough. Aim to drink enough so that your thirst is adequately quenched. The one more tip is don't eat heavily. Don't just attack the food. Meat can be nutritious and a healthy part of your diet. It's very high in protein and a rich source of nutrients. However, problems occur when meat is charred or burnt. This charring can lead to the formation of harmful compounds that may increase your risk for certain cancers. When you cook meat, try not to char or burn it. Additionally, limit your consumption of red and processed meat like lunch meat and bacon, as these are linked to overall cancer risk and colon cancer risk. The next one is get enough sleep. The importance of getting enough quality sleep cannot be overstated. Poor sleep can disrupt your body growth and sleep. What more, poor sleep is one of the strongest individual risk factor for weight gain and obesity. So before when you plan to go to bed, at least 30 minutes you must turn off your bright light, so the sleeping hormone called the melatonin can produce normally. If you stick with your bright light, so the sleeping hormone called melatonin, the production can be disrupted, which can make your sleep poor. Next one, take vitamin D if you are deficient. Most people do not get enough vitamin D. While these widespread vitamin D are not harmful, maintaining adequate vitamin D level can help to optimize your health by improving bone strength, reducing symptoms of depression. If you do not spend a lot of time in the sunlight, your vitamin D level may be low. If you have excess, it's a great idea to have your level tested so that you can correct your level through vitamin D supplementation if necessary. And the next one is get rid of excess belly fat. Excessive abdominal fat or visceral fat is harmful type of fat distribution that linked to an increased risk of cardiometabolic disease like type 2 diabetes and heart disease. For this reason, your waist size and waist to hip ratio may be much stronger marker of health than your weight. Cutting refined carbs, eat whole eggs. Despite the constant of back and forth about the eggs and health, it's a myth that eggs are bad for because of their cholesterol content. No, study shows that they have minimal effect on blood cholesterol in the majority of people, and they are a great source of protein and nutrient. Additionally, a review involving people found that the egg intake had no association with heart disease. So a patient with a heart issue can take one egg per day. So the bottom line is taking a few simple steps can go a long way toward improving your eating pattern and wellness. Still, if you are trying to live a healthier life, do not just focus on the food you eat. Exercise, sleep, and social relationships are important. With evidence-based tip above, it's easy to introduce small changes that can have a big impact over your health. Do not put toxic things into your body, like people don't let the toxic people in their life. Many things people put in their bodies are downright toxic, such as cigarette, alcohol, abusive drugs are also highly addictive, making it hard for people to give them up or avoid them. If you have a problem with one of these substances, then diet and exercise are the least of your worries. While alcohol here, let me see. Alcohol is fine in moderation, but not really good for your liver, heart. So, guys, my channel and my topic and videos almost, especially for young people who's living in sedentary ways, and when especially these days in everywhere you can see the people nearly 40-45 years old, and they are complaining a lot of pain, and the issue is the sedentary lifestyle and taking excessive things like everything you take excess is bad for health. As I already told you in this video in detail, excess sugar, excess salt, excess fat, excess junk food can make your lifestyle, your body worse, and your lifespan can decrease. So make sure, make target, make plan, make a schedule, what to do tomorrow, how to do, and how much to make target. As a doctor, we emphasizing so move at least 30 minutes move. You see around the world people using bicycle, but now too many facilities, people sitting in the car from their garage and getting off on their destination and vice versa. And the result is the one who is not moving himself or herself in the car, moving on foot, is getting more healthier than the one who is moving him or herself by car. So today, right now, watching video, grab the notebook and write down your diet plan, your moving plan, and your target plan. Stay touched. Thank you.